First, erectile dysfunction, a problem that's both common and complicated. Common because we estimate 52% of men between the ages of 40 and 70 experience it. Complicated because it rarely occurs in isolation and can be a warning that something else is wrong. High blood pressure.
This is sort of a sentinel event.
High blood sugar.
There's so much overlap with diabetes.
Smoking.
It affects the vessels to the heart.
If you're a man, these red flags can hit you in the heart and below the belt.
Hypertension, smoking, diabetes, elevated cholesterol, all of those would be high risk factors for erectile dysfunction.
ED is more common than you might think. According to studies, 40% of men in their 40s experience erectile dysfunction. That number increases as men age to 50% of men in their 50s, 60% of men in their 60s, and to 70% of men in their 70s.
If your blood vessels aren't functioning, you're not going to have a normal erection.
Often, it's ED that brings men with other hidden problems or comorbidities to the doctor.
Usually it's the only way to get them into my office is if they have something wrong sexually. And we discovered that, sure enough, that a lot of them I've diagnosed with diabetes, a lot of them I've diagnosed with underlying high blood pressure and high cholesterol.
All of these conditions can affect sexual function.
We know that among men that have diabetes, there's a tremendous problem with vascular supply to many of their organs.
In patients with cardiovascular disease or hypertension, there's some increased risk of plaque forming in the arteries, and so that the blood flow to the sexual organs are also compromised.
Finding the right treatment can be tricky.
Some of the antihypertensives have more of a likelihood of creating erectile dysfunction. So can we work with their primary care physician, shift their medicines there to see if they can have an antihypertensive that doesn't have the side effect of erectile dysfunction.
Treating hypertension may not reverse ED, but can help down the road.
There is a significant benefit to treating and controlling hypertension to maintain what erectile function you have.
Then there are the ED drugs.
Levitra and Cialis are in the same classification as Viagra.
All three drugs can play a key role in ED treatment. Patients with ED related to prostate cancer have a different problem altogether.
You feel like you're not a man anymore.
Walter Hayes battled kidney, lung, and prostate cancer, which left him
completely and totally impotent.
Typically those who have had a radical prostatectomy where the prostate is removed for cancer oftentimes have nerve damage.
And some men fear the cancer treatment because of that side effect.
The motto is, dead men can't have sex. Get the prostate cancer taken care of first, then we'll fix you up with something else.
That something else?
They would pump the device here.
Can come in several forms.
Currently, we're using either vacuum erection devices, injection therapy, or penile prosthesis, or combinations of oral therapies and those other options.
Walter has an implant.
It probably is one of the best things I've ever done in my life, because I got my life back.
And he has advice for men suffering from erectile dysfunction, no matter the cause.
If you've still got a libido and you're interested in intimacy, with today's science, you don't have to give it up. You don't have to think it's all over. It's not.
And be mindful, ED not only affects a man, but his spouse or partner too.
He does not want to be put in that position to fail again, so he'll avoid the intimacy. She does not want to put him in that same position as well. Both parties are now trying to avoid intimacy. And suddenly you have a couple who does not just have a physical problem, but also has an emotional problem.
Curing that takes more than a pill or implant. It takes time.
Got to take it slow with your partner. With most couples, I find it's been years since they've had intimacy, and you can't just jump off the chandelier the first night.
Is there a way for men to prevent ED or keep it from getting worse?
If you're a smoker, stop smoking. Maintain an adequate weight, a healthy diet. Exercise at least 3 to 4 times a week. All those things that are good for your heart are going to be good for your erections.
2 new drugs are now being tested. One works to protect and to regenerate nerves of men who've undergone prostate removal. The other works on the body's central nervous system rather than on the vascular system. The second drug is also being tested to treat female sexual dysfunction.